listening to LA After Dark with your host, Abby Cubey, only on LA Talk Radio.
Very excited today.
Very, very excited. Well, welcome back, Abby.
Thank you.
How are you?
I'm good.
Good. Well,
took off last week.
It was good, huh?
It
Memorial
was an
weekend.
emergency off.
Well, welcome back to LA After Dark with Abby Cubey, and I'm your co-host,
Moe Aboueched,
Moe Aboueched, and we have with us today
Dr. Raj and Dr. Stepan Kasimian.
Stepan Kasimian.
Yeah, it's a mouthful.
Stepan Kasimian of Haas.
Medical Group.
That's right.
Haas Orthopedic and Spinal Surgery Medical Group.
That's right.
Right?
That's correct.
Well, welcome.
Thank you for having us.
Glad to have you on the show today, and Dr. Raj, as always.
Glad to have
it
you
is
too.
a pleasure to
Mo.
have
Yes.
you here.
Always.
Thank you.
I think he is taller from last week.
I am.
Aren't
I
you?
grew. I exercised actually. I
Did
a
you?
little exercise. Yeah, I did a little few
Did you
jumping
cheat on those
jacks.
chairs?
Huh?
He's
How's your
cheating.
spine?
Spine is good actually. I'm going to talk to you about that.
I think
Yes.
he's sitting.
we
How's
don't
his
talk
posture?
about-
I think he's
Well,
sitting
see,
more,
that I say,
Let's
yeah.
look
Well,
at
he's
posture
here,
right
and I
here.
got to like sit up straight.
he's sitting
and-
more upright now that there's a spine surgeon across the
Yeah,
room.
I don't want him to go.
Yeah,
Hey,
now
you
he
need
is.
surgery, Mister.
No, today I feel very safe actually.
Right?
I have
Well,
two
you need to
doctors.
sit up straight. Come on. There we
You
go.
have to show your
Yeah.
chest out, Mo.
Yeah.
Just
Working
out.
it, working it.
Okay, you have
Chest
to
out.
work
Me
it.
too.
Got to work
It
it
is a
out.
secret.
But don't overdo it.
No, right?
It looks
Be
good.
relaxed.
Yeah, just
Be relaxed but upright.
That's right. Don't
Pump your
slouch.
chest
I
out,
think-
but not too much.
I think it's key not to slouch, but definitely if you overdo it, then you actually hurt your back.
Oh, see, that's what I always thought.
You know, is that okay that I'm wearing actually a lumbar support thing every day?
Can you show us?
No, not today.
Oh.
But it's helping me a little bit.
You'd never ask me that, would you?
Well, I don't know.
Not that
Are
way.
you
Is that
wearing a
safe to do?
lumbar
No.
support?
I think lumbar
Actually-
support is good for on a temporary basis, but if you use lumbar support all the time, then your muscles actually get used to it, your body gets used to it, and you may actually compensate negatively and you atrophy. Probably should not use it all the time.
Injure your muscles, right? They
Well,
otherwise
you-
should be working on their own to support your back.
Exactly. That's you
Right.
know, if you use a crutch too often, then what happens is the muscles sort of are not utilized anymore. Then you
I just
atrophy.
want my waist to be,
Oh, so you're using a corset for a different purpose. Well, that's
I'm
Different- for
double
different
purpose.
Exactly.
Double purpose because.
But does
I-
it make
yeah.
you walk straight? Does it?
Yes,
Do you
it
feel that you're upright when you're wearing it?
Yes, and actually lately I feel very tall.
Oh,
From
maybe
it.
I should try.
What about eating? You don't want to
Hmm?
eat with a corset on, right?
No, I don't.
No, it's actually not really good for your stomach.
No.
Right? No.
Well, my
Dr.
genius.
Kasimian,
yes.
tell us a little bit about you. We have not given you a full introduction, but we always like our guests to speak of themselves. It's always best that way. So tell us a little bit about you and your group, and so we can get into the discussion.
Sure. Thank you. I never talk about myself, by the way. At least.
This is the first time.
Well, this is a good opportunity for you.
I'm just kidding. I talk about at least my wife thinks I'm talking about myself all the time. So I'm an orthopedic surgeon, just like Dr. Raj, and he and I are sort of our practices overlap. He does the extremities. He treats patients with mostly extremity injuries and extremity complaints, and I take the axial spine. The axial spine is usually from the neck all the way down to the coccyx, to the tailbone. And even though we're both orthopedists, we both treat conditions of the musculoskeletal system. My sort of passion and my specialty is just focusing on the spine. So I do neck surgery, back surgery, tumors, of the spine, fractures, trauma, things like that.
It's really serious stuff, though.
Yeah, it's all serious.
But the
Surgery is
spine-
serious in itself.
The spine, though, is like the really most fragile or sensitive part of the body, right? Because
Well, I
it's
mean,
got
there's-
every nerve ending connected to it.
There's the heart,
Pretty much.
Right?
To me, I mean, there's a heart. That's also
Yeah.
a very major
The
organ.
brain?
The brain.
The heart and the brain are
The
easy.
knee?
We can take those out and replace them like regular business these
You
days,
could,
right?
the knee is very important.
But you're right. The spine
Yeah.
in itself. I mean, you're wrong, but you're right in
Okay,
itself.
make up your mind. Am I right or am I wrong?
No, you think about the durability of your spine.
Right.
Yeah, I mean, you're standing. Yeah, we don't fall over. We don't crumble.
Right.
Yeah.
Holding all of our weight, organs. protecting our spinal cord. So there's a level of durability with your spine. I
Yeah,
mean,
absolutely. You know, the spine is I was not trying to belittle the spine, but it is a very unique and very complicated part of our body. The anatomy is very intricate. The joint is not really a spine joint. Is essentially the disc and two sort of saddle-looking joints that slide and glide, much different than our knee joint or our hip joint, which could be a ball and socket or sort of a ball and a flat platform type of joint. So the joints are very complicated. The nerves are very specific and very, very sensitive in there. And they are, even though the spine is very durable, the structures around within the spine, the nerves are very they're tenuous and they get injured, and people can have pinched nerves and
That's what I'm suffering right now.
and
A pinched nerve?
spinal cord pathology and be paralyzed if the patient doesn't have surgery. In some cases, surgery is needed to prevent those injuries.
What causes somebody to get paralyzed from their spine? I mean, what happens to the spine that the person can actually get paralyzed to where it is not repairable?
Oh, well, okay, so the tissues of the spine are very, very sensitive, and they do not regenerate. There are some organs in our body. I'm thinking back at medical school now. Was it the liver? I think the liver actually
the
can
liver regenerates, yeah.
Yeah, the liver.
Yeah,
I think
the liver.
The liver.
Yes.
The liver cells regenerate. You can actually cut part of the liver out, and then
It'll grow back.
But you know,
Some of it will grow back.
realistically, any place that has blood supply, to a degree, with stem cells in their blood, can regenerate.
We didn't
to a
have stem
degree.
cells in medical school.
Right.
So anyway, what happens in the spine is that what the tissue doesn't regenerate, and the spine sends signals from the brain all the way down, passes information to our muscles and to our legs and our arms. And so once you sever that, there is no more connection. So the conduit or the electrical cable that sends a signal is gone, and it doesn't regenerate.
Which is generated from the spine.
Which is passed through the spine,
Pass through the spine.
spinal cord,
right.
and the nerves. Right.
Okay.
And so once that's kaput, that's it.
That's it.
Done.
It doesn't operate.
Nope, does not work anymore.
And and there's no surgery for that. There's
So
no.
in complete paralysis, we do surgery in certain cases where patients have trauma, major trauma in a car accident, for example, where there's a spinal cord complete injury. We have to do surgery in some cases when the spine bones are unstable for rehabilitation purposes, because remember, it's not just the nerves that we're dealing with, we're also dealing with the anatomy and the bony structures. So the bones have to be realigned and fixed,
Right.
just like a broken ankle, but the nerves just don't work. In some cases, it's an incomplete injury, and then the prognosis is much better. We have to fix it and then hopefully decompress in a timely fashion. And once you decompress the spine, meaning take the pressure off the spine, realign the spine so that the pressure, sort of the spinal cord is not under any kind of pressure, whether it's a blood collection or
Right.
deformity, then there is a better prognosis for the patient.
What's the most frequent surgery that you do? And how long is the recovery time?
That's a good question. The most common surgery I do is a microforaminotomy in the lumbar spine. That is simply where a single nerve or one or two nerves next to each other have pressure. And what happens is it's usually a disc protrusion or a combination of a disc protrusion and sort of the degenerative changes in the spine. In combination, pinch the nerve, and it's essentially a pinched nerve. In layman's terms, it used to be called a slip disc. It's not always a slip disc.
Right.
It's a simple pinched nerve.
So the differences. Tell us the differences of slip disc,
Okay,
protruded disc, bulging disc, bad disc, Moe's disc.
Moe's disc.
Herniated disc.
A frisbee disc?
Yeah.
Frisbee disc.
Because
Is
everyone,
British?
all of my patients come down and say, "Do I have a stupid dish?"
No.
No.
It's a German
I
for
think
I
she said
love you.
ich liebe dich.
It's
Ich liebe dich.
It's
yeah.
Even
British.
dish.
Ich liebe dich.
Schliebedish.
Ich liebe dich.
Is
Yes.
that in lieu of
Schliebedish.
what?
Ich
E.
Flee.
liebe dich.
Live it.
Exactly.
Yeah,
That's-
there you go.
yeah.
So a slip disc, essentially layman's terms, is actually a disc herniation or a disc protrusion. Disc herniation is when there is the disc between, for example, two bones. We call it L4-5. And those are the bones in the lumbar spine down below, sort of right above your pelvis. That's the most common disc herniation. The disc itself can pop out its location. The center of the disc is made of this gelatinous material. The outside of the disc, which is very tough tissue, imagine like a belt, is called the annulus fibrosus. And what happens is it tears, and parts of the center extrude out and towards the nerve area. Sometimes it goes forward towards the abdomen, intestinal area, but it doesn't. That's inconsequential. It just causes disc pain.
Right.
But if it starts heading towards the nerve, then it can pinch the nerve. And so it pinches the nerve against the rest of the anatomy, which is the facet joint, which is sort of the other part of the spine behind the nerves. So a slip disc is like a herniated disc. A disc protrusion is a herniated disc. Then there's an extruded disc, which is the disc popped out of its center, and then it's moved up and down the canal. And then in some cases, it's just a bulging disc, which is sort of a degenerative part. It's not really traumatic, but the bulge can sort of incrementally get worse. Maybe the ligament around it can tear, and the bulge gets larger. These are things that we identify on the MRI when a patient gets, and we try to correlate the MRI with the patient. And not every disc herniation or slip disc or pinched nerve is painful, and not everyone needs surgery. Actually, 90% of patients that come to me don't require surgery, and we try to treat them.
Hey, that's my number too.
90. That's about right. I think.
Yeah.
I think
You're
most
right.
orthopedists that are in the community that see patients, their surgical rate is about 10% for the patients, and I see about 35 to 40 patients a day. Is that what you see about that?
I see 2 patients a day.
2 patients a day.
Operate on.
On
What
one.
are
He
the-
golfs. He
on
golfs
10%
most of the
of them.
time.
So that 0.2%, about the same. About the same.
So what are the non-surgical options out there?
Oh, there's plenty. I always try to figure out what they've done. Have they done therapy, chiropractics? Is it postural? Is it legitimately a radiculopathy that's pinching with a pinched nerve radiating, shooting down the leg, called sciatica? And then if they have done physical therapy, if they can deal with the pain, then we give them some anti-inflammatory medications. If it's a very severe problem, we recommend narcotics for a short
What
period.
kind of narcotics?
Well,
Or
usually
morphine.
No, that's too advanced. No,
It's in the
just
back
like
suitcase.
I mean,
ibuprofen.
what are you thinking?
Hey,
I'm
that's
just
a
thinking,
conversation afterwards.
Right?
Okay?
Okay.
No, 3-4 days of Norco or some kind of hydrocodone narcotic for a short period. There's no role for long-term narcotics in
Right.
the United States. There's no role for long-term narcotics with pain. If a patient starts having too much pain, then we have to figure out where the pain's coming from. And so then we recommend an epidural. Let's say the patient has significant pain, can't walk. We give them a week of Norco. They're absolutely miserable. Can't start physical therapy. The inflammation is still significant. Their disc herniation is moderate size, and they don't have a neurologic deficit that is really severe. They're having a foot drop, for example. They're not neurologically compromised. So they're stable, but they're in significant pain. I would recommend an epidural injection, inject pain medication with an anti-inflammatory into around the spine, and I would send the patient to a pain specialist, and they would do that. But
Okay.
usually acupuncture, chiropractics, physical therapy.
Well, I was going to ask you
Hey,
about that.
Yeah, I mean,
Go ahead, Dr. Raj.
I wanted to bring up, you heard about recently 2 cases where a chiropractor did,
Manipulations.
manipulations and the
And a
patients
disc
died.
herniation.
They died?
One,
What do
one
you
was
Cervical
a month
spine?
ago, cervical spine.
I haven't heard of
Where
that.
is
And
this
one
at?
was in LA, and one was 8 months
Which
ago.
hospital?
No, it's not. It's
No,
usually
no,
outpatient.
it's a
It's just
chiropractor.
outpatient. One
Yeah.
was at a gym, and it was a trainer who did a adjustment on the
right.
neck. Young girl, and then
Oh, on the neck.
I think I heard about that.
yeah.
I think I heard about that.
And then the second one was 9 months ago, an actress, young actress, adjustment on her neck, and she passed away. Tell us about, so the adjustment component, of course, there's good and bad chiropractors, there's indications, there's aggressiveness of adjustments. What is your feel? I've always wanted to ask, me not being a spine surgeon, I wanted to ask the opinion of a spine surgeon about your feel on the limitations of what
Chiropractors should
Yeah,
do.
should
or-
do.
Sure,
or
that's a good
adjustments.
question. And so, this actually, right when I said chiropractics as an alternative and conservative approach for surgery, I'm glad you brought this to our attention. So chiropractics, I'm not a chiropractor. We have worked with chiropractors.
Yeah, disclaimer. I go to a chiropractor
Yeah.
myself weekly.
Right. No,
so-
I think chiropractics is a very good conservative, non-operative avenue for patients to seek care for their orthopedic conditions. Chiropractics, in terms of manipulations, from our perspective, from a spine surgeon's recommendation, if there's a frank disc herniation or the patient has a neurologic deficit, obvious deficit, that the chiropractor, that's why the chiropractor has to get an x-ray. At least that's what I believe.
Well,
the
none of
standard
them
is.
do, by the way.
I think many of them, there's
Many of
a
them,
suspicion, especially if there's trauma, like a
Right.
car accident, or if their
Oh, they'll
patient
do that,
falls,
right.
They have to do an
Yeah.
x-ray to make sure that there's no fracture underlying, because sometimes there's something called a distracting injury.
Right.
So patient falls, their
Boom.
knee hurts.
Distracting.
Their knee hurts because they fell on their knee. They don't have a
Right.
fracture there, but then their back hurts as well, but their knee hurts more. So then the knee is a distracting injury, and so a more significant problem can be missed in the back. So that said, I believe if there's a neurologic deficit, if there's a fracture, obviously you can't do any chiropractic manipulations. Chiropractics is not just cracking the back, which is a component that they do with rapid acceleration, deceleration maneuvers, and it the layman's terms is they chiropractor
Right.
crack my back. They also do some traction. They apply modalities to help with inflammation and swelling, and generally my sense is my chiropractic colleagues should be performing physiotherapy. So chiropractic physiotherapy is usually a recommendation when I recommend a patient for chiropractics. Usually it says chiropractic physiotherapy.
So why do we get why do we go to a chiropractor? Why do we get our backs
I don't know.
adjusted? And it feels
I don't
better.
know.
Can I
Why is
answer
that?
go.
Can I answer
That's a
that?
good question.
Yeah.
Yes.
I'm saying what
Marketing? I don't know.
I think
Okay,
it's
that-
because patients,
Access?
people are
Easy access?
No, they're afraid of surgeries. They're afraid of
Well,
So-
everybody should be afraid of
Well,
surgery.
Yes.
but they're
Right.
afraid of answers. So if you
I
go
think that's a
to
good question.
if you
Yeah.
go to
Answer.
good question or
Good,
answer?
good answer. Good
Yeah,
answer.
well, it's
To a-
both.
to a
Let's
question.
rewind that
It's
again.
2 in 1
Just
actually.
kidding. So no, but you're afraid of the answer. So by going to a chiropractor who says, and that's where marketing plays,
Yeah.
that I'm not a surgeon, I'll never cut you, I'll never stab you, I'll never,
Hopefully.
But I
So they
will
fail-
crack
they-
you.
yes.
They feel a little bit safer if they go to
Well,
chiropractor.
right.
instead.
I think acupuncturists are non-operative treaters,
But that's the one that
physiotherapists.
poke you with needles and stuff, right?
Mhm.
Oh
Yeah,
God.
holistic medicine.
They get you in the
but,
eye
but
too.
maybe I asked the question the wrong way. So why does chiropractor help? I mean, I go to a chiropractor every once in a while, and I crack my own back. Now,
Yeah.
why does cracking your own back helps?
You know,
so I get in a little pain, and I'll
Yeah.
crack my back, or I'll lean against something,
Yeah.
and the pain goes away
You
for
know,
a while.
I'm not a chiropractor, but this
Right.
is what my chiropractor colleagues tell me is that once you start having, let's say you have a misalignment, and this is what they describe it as, a
Right.
misalignment. And usually, I believe it is because the muscle is spastic. The muscle spasms in your back
and that's what I have.
because of some kind of pain source. The pain source causes the muscle to guard. We have guarding in our abdomen when we have an appendix that's
Right.
inflamed. The abdomen becomes rigid, and so the muscle guards, and then there is a shift in the joint because the muscles are attached to the spine joint, and so they say, "Oh, your muscles misaligned. I'm gonna fix it." So I think that may help with some of the inflammation when they do crack or manipulate the spine. May help with some of the pain relief. Also, I believe, I'm not sure about this, but I believe that it releases endogenous endorphins, which is the natural morphine you have in your body, that also helps with pain control.
Right.
Because many times
Right.
patients say, "I feel great when I walk out." An hour and a half later, or the next
It's
morning,
back.
it's back, and it's worse or
Right.
something. So I think chiropractics has a role, physical therapy, all the non-operative treatments, and the biggest thing is time and modifying your activities. So you have to modify your activities. If something hurts when you do it, don't do that specific activity.
Just prevention.
Prevention.
Easier said than done.
It's easier
but
said than
you're
done.
right.
You're absolutely right.
Well, anyway, let's talk about prevention. What type of exercises can you recommend to avoid all of this?
For spine, so
For
the lumbar spine, we recommend usually isometric exercises for the core. And so when I ask patients, every single day, I will ask 40 or 50 times. And sometimes I have to ask the patient twice. Same patient, because I told you earlier, I see patients, about 40 patients, and then I said it 50 times because I have to ask the patient twice, what exercises have you done so far? And they say, yeah, I've done these exercises, and then they describe stretching. So many patients will think that exercise is stretching, and that's not correct. Stretching is a component of the rehab program. But what it does is it stretches the joint, and many times they stretch their spine. You're supposed to stretch everything but the spine more, and then to a certain degree keep your spine somewhat limber. When you have a spine injury, I generally recommend stretch other joints such as your piriformis, your hip joints, your flexors, your knees, your hamstrings, and your.
I always do that.
And then
every day.
avoid your spine movement because your back's hurt, so you can't really stretch the spine. That joint is injured or inflamed. Secondly, stabilize the spine. So those are now exercises you have to strengthen the abdominal muscles, the rectus muscles, and the paraspinal muscles. And those are just some core exercises, gentle crunches, paraspinals, things like that. Those are best type of exercises. Twice a day, every other day for about 20 minutes, and then 5 minutes of stretching before and after. And I think that's a real good exercise program.
What type of exercises do you do?
For the spine, I mean, generally abdominal exercises, but you have to be careful. So when you do abdominal exercises, you can injure yourself.
Injure
with
your
crunches.
back, right.
So extreme crunches or weighted crunches. I mean,
Right.
even though you're strengthening your core,
You're
you've got to
hurting your
watch your
back.
mechanics and
Right.
how you do it. Superman's, where you lie on your stomach, extend your arms and extend your legs. You got to demonstrate these ones for us, please.
Of course. I
Right here. Do we have room on the table?
But aside from the spine, you probably recommend. I mean, you see shoulder and knee injuries, and what do you recommend for shoulder injuries, for example? Many times patients have a neck problem and a shoulder problem, and one is worse than the other, and they'll come to me or Bal and sort of be misdiagnosed as a problem with the cervical spine, but it's actually the shoulder.
Yeah.
And that's after we both operated 2 times.
Right.
on the
Those are the
shoulder.
operations we're going to
And then
talk
we,
about
and
later.
then we call each other and
Yeah.
blame and say, "Hey, it's you," and
Well-
it's bad. And then we
Well,
talk
you
about
first operate, then you ask questions.
Yes,
right.
Absolutely.
Right.
Naturally, that's what happens.
Naturally, you
That's what we
operate,
learned
then-
in medical
it.
school.
That's a 90% rule. I'm not kidding. We said 10% or 90%. Then really, it's
No, that's not true. That's not true. No, we
That is not true. They do not operate
Disclaimer.
first.
Yes.
We're just kidding.
So
All
tell
right.
me,
So
what do you
s-
recommend for the shoulder?
It depends on what's going on. So a lot of times I rule out neck issues. You have to listen to the patient. So
That's
the
right.
biggest
We
thing
still-
about
we
my
still listen
colleagues.
to our
But
patients.
here's a question. But do they know what they're saying? Do most patients understand how
Well,
to
you
explain
you
it?
have to be
Right?
a detective.
That's
Right.
I'm
Your
a
job.
detective.
So I go, I have a pain.
Right. You
Where?
don't know
I don't
that.
know where.
I remember, when I started, I would get so frustrated letting someone just talk and ramble about pain.
Yeah,
But there's subtleties in being a detective. You have
Okay.
to be a detective, take the information, and then put it
To where you
into
th-
context. And
Usually, it's when you can recreate the symptom with a maneuver, it's very diagnostic for us.
Okay.
So if it's
So
shoulder
you go
pain,
bend over, do this, stretch out.
there you go. We're
Right.
bending over,
Bend
Mo.
over.
Suppositories.
What?
Hey, where's the
Always-
I brought,
suppository?
I
What
brought
are
a
you
couple
thinking?
for you, by the way.
No.
I
For
brought
some
for
reason-
You got some. You got
Because
it.
you brag
I
about
don't-
him so much.
I don't want
brought
to
you
borrow your
some.
suppositories.
No, I brought you some.
we're getting
Serious-
distracted. We're
So
getting
you
distracted.
seriously, guys, for some reason, like it always
started
like
this.
you. No, I didn't.
You
What?
started this.
I
All right.
didn't.
But it's all good.
Always dirty.
Dirty. There's nothing dirty about a
Bend
suppository.
over.
Back to you, Doc.
suppository.
Can we keep it
Yeah,
kosher?
for example-
Let's keep,
for
let's keep
example,
it
We talked
kosher.
about that.
when we
Okay.
have a shoulder problem, and the patient says, "You're absolutely right." The patient says, I just hurt here, and it's the shoulder, but it's actually that's the trapezius region, and more times, if it's a cervical issue, it'll hit there, pain-wise. It's called referred pain. Problem will start in one area, but shoot somewhere else. That's called referred pain. And so we always ask, where does it go to? If it's a shoulder problem, it'll generally start in the top, sort of the bony area of a shoulder, and then it'll go down the arm. But guess what? The neck problem with a radiculopathy or a pinched nerve in the neck will also
Comes
go
down
down.
the arm.
That's right. So how do we determine that? Well, I asked, questions. Does it hurt more when you bring your arm up? Does it hurt more when you turn your head? And then we do some testing, and then, we also went to medical school. We look at MRIs.
Right.
We do the doctor stuff that we do, and you get good at it.
And then you say we need to operate.
Not always. No. 90% of the time we say
90% of the time it's no.
it's fine. You want us to operate more? Do you think we don't operate enough?
No,
Mo?
actually, I want to bring up a
These
topic.
are
You
the
want to
top-
see blood, huh? You just want to see. I have some pictures. Hold on.
Operate.
Where's
Yeah,
my phone?
let's just get him on the operating table.
No, I have here. Just jump right here. Well,
No,
operate
I'll
on you
pass
right
out
now.
if I see blood. I'm kidding. I don't.
I should have
pass
brought
out.
some pictures.
But
Next time I'll bring pictures.
There
of
was
my
a study.
surgeries.
He
in-
needs it.
CBS did an investigation a few years back, 5-6 years back, and they found that orthopedic spinal surgeries actually are being performed more so now than they were being performed, either 1 or 2 years prior to that. And they did a whole study on that, and I just want to ask your opinion. And what they concluded is that most of these operations were not necessary, but they performed the operation, the surgeons performed the operations anyway. Are you guys seeing that still happening? Do you see that happening? Just want to ask your opinion. I don't know a whole lot about it.
I'll segue. First of all, I think we have a society that's very dependent, and there's a high incidence of back pain. So it's a rush on treating
or
it.
chronic pain.
That's
back.
actually a really
pain.
good point.
Yeah.
You're right.
And that's what leads some of the addiction problems we've had in the United States, and this epidemic we have now with narcotics is also sort of an offshoot of that. Go ahead. I didn't mean to interrupt you, Bal.
Did you?
There-
No.
So you
Go ahead.
I don't know this CBS study, but I don't doubt that the number of surgeries,
May I have it?
the number of surgeries have increased over the last 10 years, and I don't.
Obesity has increased over the past 10
I don't
years.
know if
Because of McDonald's.
Does that have a huge
Except
impact
for the
on the
turkey.
spine?
I'll get to
obviously?
that. I'll get to
Yeah.
that. I want to answer your other
Okay.
question. I think that, first of all, I can't speak on anybody for everyone else, but
Right.
clearly, if there are people doing surgery that shouldn't be doing surgery, then
They shouldn't be doing
you shouldn't be doing
surgeries.
surgery in general,
Right.
obviously. So I think when we practice medicine, it is not an exact science. There is no number that you can punch in. A patient comes in, they put in their information, they punch in some codes, and voila, you press enter, and then next thing you know, you have this diagnosis and the recommendation.
Are we ever going to get to that?
Maybe in 100 years. Not in my life.
Not in our lifetime, huh?
No.
No.
So I think in the United States,
Yeah.
we have had an increase in spinal surgeries. The number has increased. I believe it's a combination of technology improvement, patients wanting and access to spinal surgeons, more spinal surgeons, and technology. Did I say that already?
And our activities have gotten a lot more aggressive in the last 5 years. I mean, with
I don't know about that. I think we've been doing activities.
I think we've been more deconditioned to a degree.
Yeah,
Okay.
And,
A
and
lot
we
of things are
deem
getting
we're
automated.
aggressive because life is getting too easy.
right.
Very
So there's
true.
a lot of people who want a quick fix.
Right.
I mean, a 7-minute workout. Have you heard about the
Yes,
7-minute
I have
workout?
it on
there's a
my phone.
6-minute workout.
Yeah.
Are
Right.
you serious?
Why do
Yeah.
people
I have
want
a
a
7
7?
minute.
Yeah, I see exactly.
I have it on
Instantaneous.
my
Now,
app.
Instantaneous.
So, can you imagine anyone endorsing a 7-minute workout to say,
Yeah.
"Hey, 7 minutes is what you need"? So, it's a factor of what's happening right now in life, and I think our society, our kids are more and more deconditioned, and
There's a lot of automation. We're having anywhere from the job industry all the way down, everything's getting automated. Everything's
Right.
getting bigger. The obesity question you mentioned earlier, absolutely. There's another epidemic. I think was it 50% obese? in
Oh,
the
yeah.
United States?
I-
Is that
aren't
right?
we the
no,
most-
I believe it's
50%.
higher.
no, I think it's higher. I think we're the most obese
60.
country
I believe
in the
we're
world.
60.
And
There's just
does
so
that
many
lead
fast
to
food out there.
Yeah.
Yeah.
Thanks to the.
Does that lead to more orthopedic conditions? I believe there's no definitive data for low back pain or the association. There may be some loose association, but there's no definitive data. But I believe orthopedic conditions like knee and hip, I think there is definitely.
For example, knee and
increase.
hip. I mean, it's 2 factors. Number one is genetics. So you're blessed with what you're blessed. I mean, short, tall, great cartilage, no cartilage. Strong, weak.
Right.
You got what you got. Second is environmental. So environmental is number one factor is load. So load is weight. So the more weight you have, the more
load.
5
you're
times your
carrying.
body weight goes through your knee with every
Obviously,
step. you
with your
take.
activities,
Yeah.
Right.
if you engage in certain activities that increase those loads plus your body weight, I mean, it's just
Yeah.
a mathematical calculation.
And then
Absolutely.
if you're not conditioned, you're putting yourself at damage. So micro motion, if you don't have strong muscles around your joints, if you're not stretched out. So you combine all those factors, we're walking disasters. Now, here's the problem. The problem is, as I said a few shows ago, the first 150-year-old has been born already.
Right.
Okay.
Already.
We have a 150-year-old in the world.
No,
yet.
with the technology, that's the postulate.
Oh,
the first
oh, oh.
150-year-old is
was
living
just
right
born.
now.
Yeah.
Speaking of technology, what are the technologies available out there that are new right now with orthopedic?
With orthopedics?
Yeah.
Yeah.
You want
Is there any
you wanna-
advancement of
to
technology?
tackle that one, buddy?
Yeah, no, I
Yeah,
think
buddy,
it's
yes.
buddy.
Let's do it,
Yeah,
buddy.
so here's the deal. I'm gonna tell you,
Buddy,
I'm gonna
and-
tell
I mean,
you how
you're-
it is.
So
nice way.
doctors can call each other buddy, but I can't
course.
call you buddy. I got to call you
Well,
doctor,
well,
right?
we're also
Can I
You can call
call
me
you
buddy. You can call me
on the
buddy.
golf
Yeah.
course, I can call you buddy, right? But in a
No,
radio
today-
interview, I got to say doctor.
I think we're
Well,
we're
we're-
trying to represent a profession
Yeah, of
and,
course.
Yeah.
and provide some expertise to the radio show. So
Yeah.
I think technology is definitely advanced. For example, in the microscope, we use a microscope for surgery. A lot of doctors will do endoscopic spine surgery. Dr. Raj will do endoscopic surgery or arthroscopic surgery for the shoulder, knee, and hip joint, I believe. And a lot of spine surgeons doing it for the spine. It still hasn't really improved the.
But surgeries have advanced a lot. I mean, in the
Absolutely.
last, yeah. I
Yeah.
mean, they used to, if you go for a bladder or removing your bladder, they would cut you this big. Now they just go in there.
Why
with,
do you think of the bladder? Is that the first thing that popped
not
in
the
your
bladder.
mind?
I'm sorry,
Yeah,
not the appendix, not the bladder.
The bladder, the appendix.
Maybe I gotta go.
Some
yeah.
Same
pipe,
thing.
some pipe, some
No,
bag.
the appendix. When my dad had his appendix removed, it was a
big surgery.
7-inch cut. You know, now
That's
they
what
go in
7
there.
inches is? I'm sorry.
Yeah, about
Yeah, I got it. Yeah, now it's laparoscopic. You're
Yes.
absolutely right. Technology has improved.
Yeah.
Yes.
Oh, it's totally improved. I mean, life is like getting easier. That's our problem. What I was segueing on
We're
is
getting too spoiled.
when if we're living to 150 and we're having surgeries and we're degenerating, at a certain point, those last 70 years, you're going to be crippled. So, I mean, that's the importance of prevention and
Right.
taking care of yourself. So it's
Right.
not all about that quick fix. It's all about recognizing what you do this decade impacts you on the
The
next
next
decade.
decade.
So each
Absolutely.
decade you are a response. So when you hit 40, and you suddenly lost all your hair and you're aged and you just look horrible, blame it on what you ate and what you did in the past decade.
You just look horrible.
That just
Oh my
sounded
God.
so bad. Right? I was seeing my life pass by. You know,
I didn't mean that for
It's
you.
like,
Mo.
you're done. You're done.
I'm
Like,
done. That's it.
What did you do 10 years ago,
Forget
buddy?
about it.
Hey, there's no turning back sometimes to a
I know
degree.
you're right. You're absolutely right. And some of us that have taken that chance and survived it, they're lucky. They shouldn't push their luck.
Dr. Raj is absolutely correct. You know, to a certain degree, we do have some control of our posterity and our future by, diet, exercise, avoiding some activities that may be risky from an orthopedic perspective. If you do have pain somewhere in your back or your shoulder, definitely you should modify the activity and not engage in an activity that may make that pain worse and chronic, because you have a shoulder instability from a slap lesion, and you keep throwing your football and you keep throwing it hard and harder and harder. That slap lesion is not going to get better. The
Right.
slap lesion is basically when the joint has an anchor and the biceps attaches to it, and it tears and provides some stability to the shoulder, and so that shoulder will get more and more unstable. So you did that yourself. So you have to modify some of your
Yeah,
activities.
you are responsible. Smoking, drinking,
For your body.
drugs, it all plays on, and how hard you play. I mean-
I have a question here, actually, from Steve Contrell. He really want me to ask these questions. What do you think about the changes in healthcare will affect your ability to appropriately care for people who needs your services? This is for both of you.
Okay, ladies first.
Ladies
Ladies
first.
first.
Okay, thank you, Dr. Raj. I must have left my uterus at home.
Yes.
I know, he was like
Well,
texting.
yeah, we were,
Or
we were
your
comparing our
I'm just kidding.
postures,
I'm just
sticking our
kidding.
chest out.
Well, so and I'm assuming the
Changes.
changes in healthcare. We're talking about the insurance changes and
In general.
Okay, so healthcare in the United States I think is still very good compared to
The third world country.
third world. We're talking about other first world
yes.
countries. We're talking about other first world countries. The technology in Europe, I think, access to healthcare. You know, I was born in Germany, and
that explains that. Ugh.
Ich liebe dich. Yeah,
Ugh.
I was born in Germany, and so I remember my uncles had needing always going to the hospital. One of my uncles needed to go to the hospital, and one of the things I always remember, I left when I was 11. He said, "We just takes us a long time to get to see the doctor, not in the waiting room, but it takes a few months to get in." And you know, that's socialized medicine. The access is there. The insurance company, I believe the taxes are the people are taxed more heavily in Europe, at least when I was growing up in Europe, and that paid for the car insurance, home insurance. Most people didn't have homes. Actually, we rented. I remember a lot of people are renting.
Right.
And so because you can't afford to buy a house, but auto insurance, health insurance, and some other insurances were paid for, and you just go. It just takes a long time to see a doctor or get the care done. Here, you know, we see the doctor. Most doctors that I know that are non-subsidized by university, like USC or UCLA, they're not faculty or they're not hired by the hospital. They're in private practice. You know, with the increased cost of running a practice, it's really hard to take all the insurance companies and an in-network rate, and that's why a lot of doctors, you'll see that when you go to a doctor that's been out for a while, that has a, you know, obviously good reputation, he's got good results, and you want to see that physician, he's what we call out of network.
Right.
And so the cost is a little bit higher, and it's not because what we're doing. It's our reimbursement has actually still gone down compared to what it was 20, 10, 15 years ago, but our costs have come up. But the insurance companies have figured out to squeeze the reimbursement. I don't know how. I've been in practice for 11 years. I haven't really seen it that much because I've never been in network, because when I was coming out to practice, people have already come out of network. So I came on a wave where I've always been out of network. And so I haven't really seen that change, that transition. Well, I don't know if it's luck or not. It's just
by choice.
By choice.
By choice. And
By
so
choice.
I think a lot of doctors that I hear that are maybe like 5 to 10 years older than me, so 15, 20 years in practice, they are all, they've transitioned out of network. And they did that because otherwise they couldn't afford the practice. Or they have to switch and leave their practice, sell their practice, move into a hospital-based system where they're salaried. So they don't have the overhead.
To worry about.
Avoid
So
the overhead.
are your
events.
services recommended by their physician? If somebody needs a spinal surgery or need to be checked by an expert, a spinal expert, they would send them to you as a referral because you're out of network. So how do patients show up?
That's a good question.
To see you?
That's a good question.
Well, I refer cases to
Other doctors
Dr.
refer,
Kasimian,
okay.
so
Yeah, that's normally how it works.
and it's really up to the patient. So if there's insurance issues, realistically, you have limitations on some of your insurances. Some of them don't have out-of-network benefits. Some of them are
now.
cash
So
basis.
What do you do if you see somebody and they are in need of a serious surgery, but their insurance won't cover it, or they don't have enough coverage? Do you take
Call
them
Mr.
on? Do
Trump.
you send them?
You
Call Trump?
Mr.
Do you guys call Trump?
Trump cares happening.
Trump care.
Trump
We
cares.
call him. I call him.
That's a very.
How do you feel about Trump cares? By the way,
I don't know what Trump care is exactly.
Me
I don't think Trump knows.
I don't
what
think
Trump
anybody
is.
knows
I
what
don't think Trump
Trump
knows
care.
what Trump care is.
I don't think Trump cares.
No,
Trump-
I think
Trump care?
come on, he's our president.
Yes.
I don't
That's
know.
okay.
We don't want to get into politics at this
Yeah,
point.
yeah.
No,
I think,
of course
I think
not.
it's too complex of
Yeah.
a discussion. Good question, though. How do I deal with patients that can't afford it? Well, we have a credit card application. There's something called, I don't know if it's called
Care credit.
Care
Care
credit.
credit
or
or
Yeah.
credit card, care credit.
Care credit.
And patients will, we help
Credit
them with
Karma, that
That's the
checks
other
your
one.
credit.
You
That's
first
completely
go through
different.
Credit
Credit
Karma.
Karma is the easy way to check your credit,
Right.
but I
Then you
guess
go
every
to
time you
Credit
check your
Care.
credit, you get knocked
Right.
Really?
points, right? Yeah.
I got to stop
So-
checking my credit.
You keep on checking it, it goes down points
By Credit Karma?
Really, you lose
Yeah.
points?
by checking your credit.
So
Yeah, of
we
course.
have ability to take payment plans. We have a billing company. They deal with a lot of the underinsured patients, and patients will make it affordable for them if it comes down. I've had one patient pay me for, I think it was like a $2,000 bill for 20 months, $100 a month.
And you took it, and that was,
I mean,
and that's fine, and
interest-
it's acceptable. and-
Whatever it is,
Yeah.
interest free, and no
Yeah.
bank will do that. But
Right.
he needed surgery. What am I going to say? I can't do your surgery
Right.
because of, you know.
I mean, what I
That's
do
nice
is
to know.
I externalize it. You have to. That's one business, and that's you. So whenever
Yeah.
there's a money issue with a client,
we have
I
a
tell
billing
'em,
company. They deal
I
with it.
talk to my manager, billing company, because two different things. Like,
Yeah, that's not what you guys do. You don't
We're the
even deal with
chefs.
the bill, right?
We're
You're
the chefs.
Yeah,
We don't.
Yeah.
you know, but at the same time, we have some responsibility for when it comes to that, and we'll see. Every patient is different. We're in the business of taking care of people, and
Yeah.
and so one patient can't afford it, we figure out a way.
Is there a fund?
Huh?
Is there a fund out there that
Public,
other than
public
A
fund?
government fund?
no,
or
not a
something?
government?
It's
I mean,
called
Medicare,
GoFundMe,
Yeah,
hon.
You can
GoFundMe.com.
go fund my
Actually,
spine surgery.
Some of my patients have done that.
Really?
Yeah,
GoFundMe?
GoFundMe on treatments, and surprisingly,
actually-
they've
That's
gotten
actually a
funded.
I
brilliant.
didn't know this.
Yeah.
Yeah. So
You
actually,
sent me a link of that
I've
one
got
time.
two
Yeah.
patients who
GoFundMe.
funded their own procedures with me.
Huh.
Well, under GoFundMe.
Interesting.
wow.
So it's a compelling story, and then you put it out. And
Oh,
you
I see.
watch,
And then
yeah.
somebody.
And
I
in
see.
kind,
That's good
people
publicity,
donate.
too.
Yeah, they donate, and that's
It's
there. You go.
pretty
There
cool.
is. I
So there is a
I forgot
fund.
all about that. There is.
No,
a
I know.
fund.
GoFundMe. Go
GoFundMe.
on a website. Go on GoFundMe.com.
Put
and
that
see
on
if-
your website if you
if you
cannot
can,
do this, and if you're underinsured, GoFundMe.
Well, it's tough. I mean, it's a relative basis of underinsured. I mean, we're
Right.
talking about spine surgery if they need
or
a
any,
6-hour
or any
surgery
surgical procedure.
or
Or any
the-
surgical
What
procedure.
is an average cost of a spine surgery? And I know that's such a wide question. I
Yeah,
know.
I don't
Do you want that in pesos?
I mean, the worst
Canadian
case
dollars?
scenario or the best
I mean,
case scenario.
the
Let's do
hospital-
dollars, please.
Dollars?
Yeah.
What's the
hospital,
Filipino
the hospital,
currency?
the hospital
Peso.
part will
Peso.
be
There.
usually a lot more expensive. There's a lot of risk the hospital takes. The spine surgeon takes a lot of risk. It depends on an in-network basis versus out-of-network basis. The fees range
Between
several
roughly?
$1,000s to $50,000 to $60,000.
Wow.
Wow.
Yeah, to a couple $100,000 if you include
It
the
depends,
hospital
right.
assistant, anesthesiologist, nurses. Yeah, that's
This is
very
why
expensive.
prevention is
So important.
so.
Yeah, no, and this is where it comes down to.
Yeah.
You are what you do today impacts tomorrow.
Tomorrow. I completely
It's like I
agree.
was at a class, cycle class, and
You were cycle?
You're cycle? I
Yeah,
was just
cycle.
gonna
I'm just bringing it up.
See,
I
we
mean,
did-
in your
Oh
scrubs?
my God.
in my scrubs,
In your
not just now.
scrubs.
But what the guy said is,
At least we're on the
stop
same
drinking.
page.
Yes.
Stop drinking water
Right.
because you drank for the past. What you drank the past week reflects right now. It's just an excuse to stop.
Oh my God, that's why I
Stop
have
drinking
pimples.
water? What?
Yeah, during class.
He said stop drinking water
Yeah,
during
he told it to one
Why?
of the
I don't
because
understand.
you already drank the whole week, so you don't need to drink now.
That's so fun.
Right?
I don't get it.
Let's talk
That's
about hobbies,
interesting.
guys.
Hobbies. Okay.
I wanna- okay.
I want to get into acupuncture really quick. I've been wanting
Quickly.
to ask this
Okay.
question.
Yes.
Acupuncture. How do you guys feel about acupuncture? Do you encourage it, not encourage it? Do you think it works, it doesn't work?
Okay, my true opinion,
Yeah.
or my political opinion.
No, true opinion.
True
I want your
opinion.
honest
A
opinion.
true opinion
What are you, Trump?
is
My true
Yeah,
opinion of my politics.
Oh
okay.
my God.
We're all learning. See that? It's a
True
whole new
opinion.
movement.
Number one, I'm naive about it. Okay, so what they talk about what acupuncture cures is everything under the sun.
Right.
Number two, sticking needles in you and just wait. I think it's
Hodgepodge.
yeah,
It's horrible.
exactly.
Well, I think it's a
But-
gating mechanism. I think it works through the gating.
dating mechanism?
Gate.
Gating.
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 Gating
So
meaning-
what do you mean gating?
So
Yeah.
I think the way it stimulates a certain nerve that
Right.
sort of feeds back a stimulus to the brain, and the brain shuts off that pain sensor. That's my understanding of
Okay.
acupuncture. I could
Right.
be wrong though. I mean, that's
Yeah, it depends on where they stick those needles.
yeah.
Scientifically.
I mean, obviously, every acupuncturist is no acupuncturist. It's a training process.
Right.
There are different acupuncturists. There's skill levels and quality and things like that. Just
But-
like any doctor.
Not negating acupuncturists out there. I'm naive. I'm ignorant in regards to that. So
acupuncture.
I need a lot more training. Now, I will tell you something. Reiki, energy work. I had TLC, the network, approach me about bringing some clients to this famous energy healer where he just doesn't touch you, but he corrects
heard of that.
pain.
I've
Yes.
heard
heard
of
of
that
that.
too.
Actually,
There was
you-
one guy that wants
you
to
may
come
be-
into the show and wants to do it.
you may be on that show. I told you as my
Oh.
client on TLC.
I need it on my butt.
Okay.
Oh, I'm sorry.
Okay.
Healing.
How do I
and-
say
What?
that?
Yeah,
You mean
Sorry.
your
How do-
I
back?
mean my
Your back?
herniated whatever.
Herniated butt.
Yeah.
So what you're
Herniated
trying to say
butt.
is you've got a disc herniation and it's
Yes.
shooting down to your buttocks. That's the pain that you're
Right.
feeling.
I'm feeling it like right here.
your sciatic nerve.
So that's-
probably.
Sciatic
right.
nerves.
Yeah.
Oh
That's
my
right.
god.
So
Your
I mean,
sciatic
we
nerve.
understood what you meant. It's
Yeah.
just
There
it
you
came out the wrong way.
Yes, my
You
butt.
need
But that's
healing
why
on
you're
your butt.
that's why as a
Came out.
patient it came out period. That's why as a patient, you
came
know,
out.
it's the
Come on.
doctor's
And
job
this is
to-
why they
that's why we go to school.
yeah, and
Yeah.
they investigate
I
and they
mean,
detect
that's
So you
it.
guys know the terms, the proper terms, but with me it's just like I generalize
But-
it.
So that
But-
energy healer. So
Yeah.
what do they do? They don't even touch you.
They don't even touch. Actually, I went to a guy in El Monte because of my friend. He
All
was
the way
a-
to El Monte? You found
Yeah,
one in
I
El
actually
Monte?
made my way to El Monte on the bus. No, I had a friend. I'm going to use your private plane next time. I had a friend tell me about this guy, Master Zhao. Incredible.
Oh,
okay.
This guy didn't know English. He's flown all around the world. CNN has done an thing on him, and he laid me down. Didn't touch me, but he was burning my back and my shoulders.
You sure he didn't have like a lighter on his other hand?
Yeah. Right.
I was wondering because I kept on saying, he told me, his granddaughter say, ouch, ouch, ouch means stop.
Ouch.
I must have said it about 100 times and I was twitching like that
And
as
he
he was
didn't
doing
understand
that.
what ouch meant.
Yeah.
Does he speak English?
Well, you know what? I
Well,
used
ouch
to
is
go.
Cantonese for
No, he
continue.
didn't speak
Continue, right?
I'm just kidding.
I used to go to a Dr. Kevin Michaels, and he did the same thing. He was a chiropractor, but what he did is he'll do this healing where he touches both areas, the front and the back of it, and it's the same thing with the energy, and then he corrects you. And I'll swear by it. I mean, this guy did miracles. I mean, I would walk out of there. I would walk in like, stooped and couldn't even move, and my energy was low. And I'd walk out of there climbing the trees.
Were you drinking Gatorade during the process as well? Because I think the Gatorade.
No,
may have
I was
something to
drinking
do-
Glow actually.
He was drinking Red Bull while he was doing that. So all the Red Bull.
Well, he
energized
always
him.
love
said,
it.
take the shot first.
And you'll be fine.
That's insanity.
And I said, what
Yeah,
is that?
I
He
mean,
goes,
you know,
"It
there's certain
helps."
things we don't
Yeah.
know. We don't have
Right.
we're different scientists. You know,
Yeah.
we went through a different type of training, and our science is
they're
different.
more into facts.
No,
No,
I don't
not
want
at
to say
all.
that. I'm just saying
No.
it's just a different science.
Right.
You know, I'm not saying holistic versus non-holistic, allopathic or holistic medicines.
But do
better.
you believe in holistic medicine? Do you
Holistic?
practice it? Do
I don't
you-
practice
Yes.
it because I didn't train in it, and my interest was not geared towards that direction. My gear, is, you know, we're physically seeing nerves,
Right.
joints, and you know.
Right, but
correcting
like,
and
but
managing
some
the
doctors
problems.
actually apply it to their practices.
I do.
Yeah.
Actually,
I mean, I
have
refer
a-
out, like I said, to acupuncturists, and I am not averse to
Right.
referring out, but do I understand it enough for me to explain the risks and benefits of that treatment for that? I can't. So I say
Right.
always go to that doctor and then see what happens.
Let's talk about fun stuff.
Fun stuff.
Oh, groovy,
Yeah, there you
baby.
go.
Let's do
I'm
it. Let's
with
talk
it.
about some fun stuff.
I
Fun
thought we were
stuff.
talking about fun
What-
stuff for the last 45 minutes.
That's what I thought. I enjoyed
Okay,
it.
we were talking about pain.
Pain. I know, disc
You know.
herniations.
All right, we
all
actually
those
have
stuff.
only a couple of minutes left.
I know. I want to talk about it real quick. Hobbies.
Hobbies.
The girls wants to know.
The girls want to know. Well, I drive cars, and I drive cars on a track.
Oh, what do you drive?
I have a Dodge Viper, and I take it
No.
out to the
I
track.
like
It's
it.
a nice American car.
Nice. The old Dodge
Raj?
Viper
No,
or the new?
one.
The new Dodge
the
Viper.
real one.
The real-
the best one.
Yeah.
I sit in his back seat.
The Dodge Viper doesn't have a back seat.
seriously.
I'm in the baby seat as he ties it up, and I close my eyes. No, hobbies, working out. You know, just I mean, every moment is a hobby for me. I enjoy every breath I take.
I love
Wow.
it.
Right?
I
love
love
it.
that.
Very deep.
You know,
I
that's
know.
I thought that isn't that a song?
Yeah.
Hobbies?
Every breath I take. Hobbies.
Yeah,
Come on.
because we haven't
Top
talked.
I
Gun,
love
from Top Gun.
I love life. I love movies. I golf.
Movies are fun.
I-
Did you watch
movies are-
Baywatch? Anyone watch Baywatch?
No, I
Not
haven't
yet.
gone. I
Amazing.
haven't seen it yet.
It's
Is
a
it
good
good?
It only had an 18% rating, but it was amazing.
Really?
I want to get into volleyball, beach volleyball. So I'm actually
And?
like trying to get really like having 6 packs because
Beach volleyball is a great sport.
I'm
It
moving
is.
to Malibu for the whole summer.
It's good for the whole body.
Let's talk about our giveaway.
MSM, give it away. Give it away. Give it away. Give it away
Why
now.
did you
That
do
was a
the
song.
giveaway?
Give it away.
And
Give it
let's
away.
do the
right?
giveaway
Red Hot
for-
Chili Peppers.
Yeah.
Yeah.
Tonight, by the way, we're sponsored by Enovix Pharmacy, so we will also announce it very shortly after Mo.
So we don't have a whole lot of time, but MSM Luxury Estates is giving away a free consultation 15-minute consultation. So if you're interested in buying a house and you just don't know what to do, or you are in escrow and you just need more information, you don't want to rely on the people that are involved in the deal, you can call us and we'll give you a 15-minute free consultation on anything real estate.
Sounds great.
Very good.
Anything.
like it.
So if you call in and mention LA After Dark, Abby Cubey Moe Aboueched, you'll receive a 15-minute free consultation. Real estate consultation. And when you're ready to buy, Dr. Kasimian, you can call us, MSM Luxury Estates.
Especially
do it.
call me.
I will.
Especially call her.
Yes.
Perfect.
Okay.
And a winner for free face scan and personalized cream.
It is Maria Dubsuv.
Dubsuv.
Yeah, I think I said that right.
Interesting.
Dubsuva.
It's a
Is it
Dubsuva.
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 Oh.
Maria
I thought
Dubsova.
it was French, but now it's Russian.
It's Russian, yeah, Dubsova.
First you were saying
I was trying to make it a little,
I
exotic,
liked it. It was good. You did a good job there. You could go
Maria
either way.
Dubsova, you won a facial
Congratulations.
cream.
Visha free face scan, sponsored by Enovix Pharmacy.
Sounds great.
And where can she go for that?
1111 North Brand Boulevard, Glendale.
Make sure we have enough ones there. 111.
Yes.
1.
And I'd like
What?
to...
No, 3 ones, I
No,
think.
no, she said 4
Is
ones.
it 4 ones or 3 ones?
4 ones.
Oh, 4
See?
ones. You're
Told you.
right.
111.
111.
1.
Or 11.
Or 11.
1111.
Ooh, 11,
Yes.
11.
Or
I'd like to
1,111.
1.
Yes. Well, thank you very much for coming in, and I would like to have you
My
again.
pleasure. My
Very
pleasure. Would
soon.
love to
Dr.
come.
Let's
Kasimian,
talk about
it's been a
cars next
pleasure.
time.
What is it?
Let's talk about cars
Cars,
next time.
absolutely.
Yes.
I'll bring some video of my track days.
Yes.
I would love
That
to
would
see
be-
that.
yes.
Dr. Raj, as
Dr.
always,
Raj.
thank you for being here. Abby, the beautiful Abby, you're always the best. And till then, thank you for tuning in, and we'll see you next week at LA After Dark with Abby Cubey
I
and
wanted
Moe
to do this.
Aboueched.
You're listening to LA After Dark with your host, Abby Cubey, only on LA Talk Radio.